Good morning, child. My name is Anthony, and I'm going to be your nurse today, and I'm going to help you get better.
Hi.
Hi, my name is May, and I am Stephanie's mother. We're so happy Stephanie's finally going to get a heart today.
Do you know why you're here today?
I'm here to get a new heart.
You're right. You're here to get a new heart so you can get a lot stronger.
Wow, sounds awesome. But is it gonna hurt? Mom, I'm scared. Is it going to hurt?
Don't worry, they'll take good care of you. Nurse, everything will be okay, right?
I understand this is a very stressful and scary thing for both of you. I'll be here by your side to make sure you get through this process.
Mom, I'm scared. I want to go home.
Well, Stephanie, I brought you a doll so I can show you what's going to happen. So basically, they're going to make an incision right here, and they're going to take out your old heart and put in a stronger, better heart. So before the surgery, your child will be examined by the transplant team, including the surgeon and the anesthesiologist. And then testing procedures may include chest x-rays, EKGs, echocardiograms, and then we're also going to place an IV in her arm. We're going to do some blood sampling. We're going to take vitals, and we're going to complete a review of current medications before we actually start this. Oh yeah, May, your child will have a breathing tube, which is connected to a ventilator. The ventilator will help your child breathe until she wakes up from anesthesia, and usually it stays in place for a few days. The child will not be able to talk while the breathing tube is in place. You got that?
Okay. I understand. So what else can I do to help?
It is important that you stay by her side during all of this and keep her calm as possible. It's also important to make sure she has lots of rest after this. Since she will have an open wound, just make sure that you and your daughter wash your hands, and you will need to monitor your daughter's incision site all the time. Hey Stephanie, if you see any blood or liquid where your heart is, will you promise me that you will let your mom or me know so we can take care of it?
Yes, I promise.
Also, man, I wanted to add that your daughter will be on a lifetime immunosuppressant medication to prevent her body from rejecting her heart. So it's very important she does not skip a dose. A monthly biopsy will be done to make sure everything's okay and everything's going as planned. These biopsies are going to continue for a year. If there's any signs of the expected rejection, such as fever and whatnot, additional biopsy may be done.
Nurse, are there any complications I should be aware of?
Since your daughter is taking these medications, she will have a weak immunity and will be at high risk for infection. So it is important to maintain good hygiene and make sure she gets a yearly flu shot. She should not receive any other vaccinations for the first 6 months since her immunity is weak. So after the first 3 months, we recommend that your child wears a face mask when going outside or coming to the hospital. Do you have any other questions?
Yeah, I have a question. My daughter here likes to ride bikes. Is it okay if she can still ride her bike after surgery?
Good question, May. After surgery, exercise will be an important part of recovery. A physical therapist will work with you and your child while she's in the hospital, and will usually continue to do so for the first month after discharge on clinical days. Once your child has healed completely from transplant surgery, which probably takes around 6 weeks, there will be a few restrictions on her physical activity. For the first 6 to 8 weeks after surgery, it is important to protect the breastbone, the sternum, because it was open during surgery. Also, your child should avoid climbing, riding her bike, and other activities that may cause her to fall for the first 2 months of surgery. She should not lift any heavy items. She should not raise her arm above her head. And that's about it.
Okay, so how do I take care of Stephanie's incision once we get home?
May, once again, another great question. When you get home, it will be important to keep an eye on your child's surgical incision as they heal. Your child can take showers while the incisions are healing, but the incision should not be underwater in the bath until healed. As the incision heals, they may itch. This is normal. Try to prevent your child from scratching it by putting a tight t-shirt on her, and keep her fingernails short. Also, keep the area clean and dry. Pat drying after bathing, alright? And do not use lotion or cream on the incision. This can trap bacteria causing infection. Do not use baby powder on or near the incision. The powder can keep the incision from closing or healing. Also, you can always call the transplant team right away if you see any redness, opening of the incision, or drainage from the incision. When the incision is completely healed, use sunscreen on the scar when your child is exposed to the sun. This scar will be sensitive and may burn easily.
What's a sign of infection?
Signs of infection may include a fever greater than 99 degrees Fahrenheit, chills or sore throats, ear pain, nausea and vomiting, diarrhea, perhaps a productive cough, a burning feeling with urination, redness and swelling around the cut or wound, or perhaps. Don't be alarmed when you visit your daughter after surgery and she has a tube sticking out of her chest. This tube is called a chest tube and it helps facilitate drainage out from her incisions.
Thanks, Nurse Al. You're the best.
Of course, ladies. I'll see you after the surgery.